Today on this episode of Straight Talk, I'm pleased to welcome three industry professionals. We have Michael Patterson on the bottom right. He is the Executive Director of IEHA, a division of ISSA, and also Charline Gooley, who's the Superintendent of Building Services at the University of Illinois. She's a director with IEHA, and Gregory Gardner. He is the Director of Environmental Services at Crothall Healthcare and also an Associate Director with IEHA. Welcome, all three of you.
Thank you for having us.
Boy, the news recently about the Supreme Court, their decision about the vaccine mandate, they said that small businesses don't have to comply with that. However, one segment, one vertical in our industry is healthcare. And so the healthcare industry has to follow that mandate. And that applies to IEHA and the cleaners that are involved with the healthcare sector. So, Michael, let's start with you and just talk about what this means for your IEHA members. There's some 76,000 healthcare facilities, as well as home healthcare providers across the country. That's a statistic we see. What does this Supreme Court decision mean for them, Michael?
All right, Jeff, and that's a great question. For IEHA members, the mandate was one that was actually needed. What does it actually mean? It means that 65 to 70% of IEHA's membership, which are within the healthcare system, would fall under this particular Biden mandate. It's a good scenario because we want to make sure that our members are safe. We want to make sure that they're protected and that also they feel comfortable going into work. We actually did a small poll of our membership just to kind of see or to kind of to gauge the pulse of the organization. And they overwhelmingly said that they were extremely happy that at least that portion of the mandate was put into effect to ensure that their staff would be protected, staff would be required to be vaccinated or take a COVID test at least weekly. So they're pretty excited about it. Now, obviously, we have other portions within IEHA that will not fall under that particular mandate. However, those that are in healthcare are extremely excited about it, and they're happy that it was put into play.
Let's talk to you, Charline and Gregory. Let's start with you, Charline. Mm-hmm. When you heard this news, what were your thoughts? Were those members in your area, were they disappointed to learn they had to comply? It sounds from what Michael said that maybe it's not all bad news at all.
Well, I agree totally what Michael just said. However, we did have some people that was very reluctant about taking the COVID shot. They were reluctant because they wasn't sure what was going to happen to them in the present or the long term. So we understood people had fears. But I can really say I am really grateful that my staff complied. We have about 3% of our staff who haven't complied as of today. However, they were given the declination for the religion and the medical exemption. So we do require them, even though they have the medical and religious exemption, we do require them to get a COVID, a saliva test twice weekly. And they have to do what we have in place at UI is a health check. So they have to go on to their app and check in their temperature each morning before they come into the facility. And they will still have to be tested twice a week. And they still have to wear face covering and outdoor and indoor as long as they're on any part of the medical center or the campus. So yes, I saw a lot of fear, but people did come to realize that being vaccinated helped us save lives. They did come to that realization. And just think about if we as healthcare workers were not vaccinated, what would happen to our patients that came to us? So we would still have constantly spread the COVID, and we would still have a lot more fears than we have now. So I'm very, very grateful that my staff did come to the realization that this is going to help save lives and this is going to help stop the pandemic.
Well, thanks. And Gregory, what would you add to that? Anything?
Um, very, very similar experience at our facility. I think that if anything, I think when it's kind of went back and forth and the Supreme Court was reviewing it, some of our associates that were not vaccinated ended up contracting COVID, and they have a different outlook now. And when decision was reached, it was say, hey, we're going back. We have to make sure it's mandated now. We want to make sure we ensure that not only our associates, but everybody coming in the facility is taken care of or in a better state. It did help change their outlook to where they're more inclined to get vaccinated now. And even some of those that were still reluctant are still, even though they don't really want to, I think they see the bigger picture. Again, we remind our associates, you still have to mask, you still have to be socially distanced. But I think the surge and the resurgence of another surge with this new variant has really, I won't say eased, but it just really made it more important for people to understand why the vaccination is so important. So definitely our facility and our sister facilities are, we have less resistance than we did before.
Yeah.
So I'm excited about it because I think that's one way, that's just another big thing that's going to help us beat this, get out of the pandemic.
Of course, we're dealing with the Omicron variant right now. Who knows what's coming next? So we have to be ready for the future.
You do.
When we think about healthcare and this mandate, many out there who read the news, watch the news, they think of doctors and nurses, but that's not what we're about. You're about the cleaning professionals. You call them EVS
Right.
personnel.
Mhm.
So let's talk about that. What does it mean for the buildings you serve if you have to let go of people or you have a lack of employees? Let's start, Charline, let's start with you on that. What does that mean? What's going to happen with patient care?
Well, what I can say about that now with the new variant, we did have a lot of people go out sick. So we did not have people who was not vaccinated. So just like I said, we was grateful to get majority of our staff vaccinated. However, with the new variant, it was very contagious. So people have gotten sick. We had staff going out 4 or 5 employees at a time per shift. So that left us with, we had to put strategies together to talk to outside agencies and contractors to come in our facilities to help us out, because we still had to give the same level of care, to the same level of cleanliness to the facility as we did before the variant hit. So what we did was we kind of put our heads together as a management team, and we had outside staffing come in, and they taking care of our ancillary or our public areas, while our staff who are trained to go in and clean patient rooms went in to do that. So we kind of balanced it out to be able to still give the same level of service that was given to the facility before the variant happened.
Okay, and very good. And Gregory, what about you folks? What are you going to do with this situation?
Yeah, very similar. We've been hit. And I'm at a smaller facility, so my staffing is not that large anyway. So we've definitely experienced the shortages in staffing, but we were able to, use some outside agencies and have them come in and kind of fill some of our gaps. We did reallocate some of our staffing. Our administration worked with us to, help everybody understand that, office areas or things like that, they can kind of service themselves, so we can reallocate, make sure our patients are taken care of. So we've been able to do that as well, so that they don't lose that level of service that's there. So we have been successful in that point. I think the biggest thing is that with or without the vaccination, because the Omicron variant is so contagious, I mean, people have still gotten sick. They just don't get sick to the extreme that they were getting sick before. So thankfully, people have been coming back a lot sooner, within 5 or 7 days versus the 10-day, 10, 14-day period. So that definitely helps. So we're just trying to make it through it.
Absolutely. And I have to, your crew, your EVS personnel, they're in the rooms, they're keeping everything clean. And I can imagine there's some emotions involved with this entire scenario, strong feelings. So that has to be dealt with. Michael, let's go back to you and talk about what your members are doing to comply or what they're planning on, because this applies not just to employees of facilities, but also contractors that come in. So if you're going to hire a flooring contractor to come in, I imagine there's some issues with that as well to make sure that they comply. So Michael, tell us what is the plan?
Okay, let's start with the contractor side of it. What our conversation has been is that you need to make sure that those members are either vaccinated or you're getting them tested at least once or twice a week, because they're going to be integrated potentially with staff that may be in-house staff and not necessarily contractors. So you have a hodgepodge of individuals, and you want to make sure that everybody's protected. So in a normal healthcare setting, like with Charline and with Greg, it's mandatory by policy. The policy will dictate based on whatever the chief executive says that this is what's going to happen. So for IEHA, we push our members to comply, Jeff, with the mandates of their organization. Take away your personal feelings or your personal beliefs or your what have you, and do the right thing in terms of trying to protect yourself as well as your employees. Think about it. The employees are going into patient rooms, or your EVS staff is, for the lack of better words, your EVS staff are going into patient rooms. The patient has been COVID, has been vaccinated, but the employee hasn't been vaccinated. So potentially you've got an employee coming into a room that can now potentially infect a patient. So the goal is to ultimately get all of them to eventually comply and actually take the vaccine. But again, if they're not just absolutely not going to do it, they have to adhere to the mandate as far as actual COVID testing once or twice a week.
What does this mean when the rubber hits the road for hospitals, for nursing homes, and thinking of like making this up here, Bob's Carpet Cleaning comes in to clean the maybe a couch or two in a nursing home, and when I had my cleaning business, I did that. And I imagine now I'd have to show my vaccine card to do that work. I think that's the point. And if I don't have that proof, then I can't come in. So that could affect some of your contractors.
Oh, absolutely, absolutely. And a lot of companies, Jeff, are moving towards the contractual side of it. So they have to put things into play to make sure that the contractors comply. I know I came off of the Department of Defense side of it. So the Department of Defense is very specific because it's obviously the government, and it's built directly into the contract what the requirements are, and that your employees, they don't give you options to be vaccinated. All of your employees will do this vaccination, period. So it's mandatory. Now, are you going to have scenarios where you're going to have a few people fight it because of the union environment? Absolutely. But those are few and far between. But normally in a contract setting, especially on the Department of Defense side of things or the government, it's a mandate, so you're going to do it. Charline and Greg work more in-house, and even though Charlene's in a state hospital and Greg's in a more private hospital, their policies are going to be very similar. And they try not to force the employees to do it, but they do put parameters, as you heard, into play in order to help make sure that they protect their staff as well as the patients as they clean.
Thank you. So Charline and Gregory, anything else to add to Michael's comments before we wrap up today?
Yeah, I think that, like he was saying, even though it's mandated, Just like my hospital system, they're still working with the employees. You know, you can get your declination for religious reasons or medical reasons, what have you, but they're still working towards, hey, you did that. Instead of, you know, going to the extreme and not having to be here anymore, let's work towards, let's try again, still take your testing, you know, twice a week, but then we'll revisit this again in 3 weeks to say, hey, can we go ahead and get vaccinated now because, you know, whatever reason, because we want to retain them as employees. We understand that this is something they weren't expecting. It is something that is necessary based on the pandemic, but I think I really appreciate, I think their take on complying with the mandate in a way that it's not pushing people away, but really trying to pull people in and to help them understand why we want to do it. So more to come.
Yeah, appreciate that. So Michael, I assume that if anyone in the healthcare industry has questions, they can reach out to IEHA and get that information.
Absolutely. We're always happy to help. You know, we're in the business of helping to save lives as well, Jeff. Even though we're not doing direct patient care, the things that we do as environmental services professionals do make a difference, and we're part of the link in the chain of infection control. So we want to be, you know, actively assisting anyone, members or potential members, if they have questions or need some support.